So welcome, Dr. Zouves.
Thank you, Michelle.
Really great to finally have you, sit down and actually talk about something that I know is really important to you. Without further ado, let me just give you a little bit of an overview of Dr. Zouves. So Dr. Christo Zouves has been involved with IVF since it came to North America. He's helped thousands of families across the world realize their dreams. He studied medicine in South Africa, did his residency in London, England, and finally became board certified in Canada. We are so glad that in 1992, Dr. Zouves moved to the United States to practice reproductive medicine and opened Zouves Fertility Center in 1999, which is in Foster City, California, in the Bay Area. He and his team take a progressive approach to fertility, combing the latest technological advancements with holistic modalities to aid in achieving individual and family goals. In addition to authoring Expecting Miracles, Dr. Zouves has written extensively in medical publications, including Fertility and Sterility and the Journal of Reproductive Medicine. But really, most importantly, Dr. Zouves has been a trusted partner of Donor Concierge since I think we started this company, and Gail started the company in 2006 and probably before. So welcome, Dr. Zouves, for joining us today.
Thank you, Michelle, for that kind introduction. And, I have certainly been working with your founder and CEO, Gail, since the late 90s. And, certainly the Donor Concierge is my go-to concierge service for locating egg donors, gestational carriers, and of course, more recently, even sperm donors for our patients. So I really do look forward to spending this time with you today and, talking about our topic here.
Right, exactly. So recently we talked and you said to me that IVF is truly like a triathlon. And you take an individualized approach. What do you mean by that?
Sure. You'd never dream of doing a triathlon, where you run and swim and ride without training. And IVF really is no different. Because if you think you can just pick up one day and do an IVF cycle, you're not going to get the best results because you do have to train and you have to weigh up because there's a balance. Do you train forever and then you get too old to do the triathlon? You want to try to strike a balance between getting the most out of what you can do ahead of time and then moving into treatment. So it's no different than a triathlon.
Yeah, and another thing, I mean, as a former IVF patient myself, there's a feeling of being out of control. And I think that, and we're going to dive into holistic IVF, but this kind of program gives control, helps people feel like they're more in control of something that feels completely out of control. Would you agree?
Sure. Oh, absolutely. When we face anything that kind of defies a quick fix, it engenders this feeling of loss of control. And so what we want to do through setting a plan which starts with optimum health, to which we then add the maximum science, and then for a patient or a couple, direct them to the choice of the best modality of treatment. Once you regain that control over this journey, a lot of things then, go better.
So getting into, that's the next slide. What is holistic IVF? How do you explain this?
Sure. So holistic IVF embodies the fusion of starting with optimum health. And then once you're on that path, you want to add to that maximum science. And of course, the optimum health is what each individual patient or couple can do for themselves as you gear up to do whatever treatment modality you need. And then the maximum science is up to the IVF program, that you're working with. And today we're going to focus on the optimum health side of things. And I believe shortly we're going to do another webinar which will focus on the maximum science.
Correct. So I just put one sort of overview of the differences between your approach, optimum health, maximum science.
Sure.
As you said today.
What we're going to focus on here is the holistic IVF side and the Optimum Health side. And as I said, the maximum science will come later. But we are going to touch on a number of areas here. We're going to touch on organic choices for eating. And if you've been really abusing your body diet-wise, you want to look at maybe doing a cleanse or a detox. We're also going to talk about gluten, dairy, and sugar restriction, low carb and high protein diet. We're going to talk about acupuncture, yoga, and exercise. Supplements are really important for both gamete providers and carriers. And we'll talk about the mind-body effect. And then, of course, the lifestyle things, which some of us are still doing while we're trying to make a baby. And we're going to talk about BMI, smoking. We're going to talk about what to do about alcohol as well.
If we talk about inflammation, what is inflammation exactly?
Sure. Inflammation, is actually an amazing part of our immune system. It's protective in that it helps us heal from surgery and wounds. It helps us make antibodies against, nasty bugs that we are either exposed to naturally or vaccinated against. But, some of the negative consequences of inflammation gone rogue on us, would be cancer, heart attack, stroke, arthritis, or a formal autoimmune disease where the target may be a joint or your bowel. And then, of course, the thing that, really interests us is the effect of excessive inflammation on reproductive potential.
I do know, and I'm going to talk about myself here, but when I was going through IVF, I did almost everything I thought I could possibly read about, which was decreasing coffee, drinking coffee, all the things that you read about, but you have no idea whether it works. And then when it doesn't work, you start blaming yourself. And so it's really important. I think things have changed a lot to have this guidance from the clinic like this. I didn't have any of that back in the day. So I'm really impressed, as I said, with Dr. Zouves' approach and the Zouves, the clinic, because it kind of embodies everything that people need during a cycle, not just the medical part of it. So that's my opinion. I know there's probably a lot of people on this webinar that have gone through IVF or are going through IVF. So it's just so important to kind of consider all these things, and also not to blame yourself if you don't get to these things too, but to try to incorporate them into your lifestyle. I think mainly the question was, what inflammation, how does it actually affect the reproductive cycle and IVF? If you're going through, what are the things that it's causing? And also, how do we decrease it? That's the next slide. So we'll go back to that.
Sure. So, as we mentioned, there's a certain amount of inflammation which is life-saving and, integral to just our survival. But when it's elevated outside of, the diseases that we mentioned, and of course the individual autoimmune diseases, it can affect reproduction. And the way that happens is, from the implantation point of view, you can have excessive inflammation directed to attack that placental site when the implanted embryo is still, at the microscopic level. And that would be one way that it can affect reproduction. But even going further back at the level of the egg, and to a lesser degree at the level of the sperm, if you have excessive inflammation before you go to make the eggs through the stimulation and the retrieval, that can affect adversely the quantity and quality of eggs.
Okay, so let's be positive now. How do we decrease inflammation in the body? What's your prescription for that?
Sure. So my prescription is really the prescription for living a healthy life, being healthy, and having longevity to be able to look after, these little kids that we're all working so hard to make. So how can we decrease excessive inflammation? You can do it through diet, and we are going to expand on that in a minute, but it's my favorites: decreasing or eliminating gluten, dairy, and sugars. It also looks at embracing mind, body, mainly because when stress is elevated, and again, we'll talk about this in a minute, stress elevates your inflammatory or your immune system, and that impacts negatively the implantation of embryos at the other end. We also want to look at lifestyle. Again, we'll talk about this in a minute. Exercise, no smoking, no alcohol on the egg producer and carrier side, and limited alcohol on the sperm side. And if we try all of that and the inflammation is still excessive, we have all of those medications available to people with an autoimmune disease. And goodness knows, we all see these advertised on the television. These are the group of medications called the biologicals. We can also resort to those if the Optimum Health doesn't do the trick.
Okay, so there we go. So we've got our list of good foods. So let's walk me through some of this for nutrition.
Can we go one slide back?
Oh, I missed one, correct.
So, you know, when we talk about optimum nutrition, gluten and dairy-free, absolute prerequisite. Gluten, the protein in wheat, barley, and rye, which is gluten. Casein, the protein in cow's milk and cheese and yogurt. Those two proteins fire up the inflammatory system. So we need to cut those out. And we also need to focus on cutting out sugars. We also want to have a diet which is high in protein and low in carbohydrate. And this is especially important when we talk about trying to manage increased BMI, which is, you know, one of the lifestyle things we want to work on. We want to focus also on the healthy fats, avocados, amazingly healthy fat, and also olive oil for eating, avocado oil for eating. And then all of those amazing veggies. And my favorite family is the cruciferous family. And we'll look at those again, you know, the kale, the cauliflower, Brussels sprouts, and cabbage. All of those are amazingly anti-inflammatory. And of course, the link here that we're interested in breaking is the link between gluten allergy on the one part, which is celiac disease, or gluten sensitivity, which can cause all sorts of reproductive issues, can contribute to unexplained infertility, recurrent miscarriage, intrauterine growth restriction, and low birth weight.
Okay, we're ready for our good foods. Tell us about.
So here are the good foods, and we're all, of course, hungry at the moment, aren't we?
Yeah,
okay?
Definitely.
So really the good foods we want to focus on are the fatty fish, salmon, sardines, herring, and mackerel. Those of you who are sushi and sashimi fans, you know, the higher on the food chain that you eat, the more you expose yourself to heavy metals. So, you know, the maguros, the tunas, the hamachi, the yellowtail, these are all predator fish. They all accumulate heavy metals. So you want to focus on wild salmon, sardines, herring, and mackerel. You want to have lean meats, and you'll see in a minute, red meat, probably not more than once a week, but chicken and lamb. And you want, if possible, to get grass-fed and organic in that area. You want to focus on blueberries, blackberries, raspberries, strawberries. They have amazing antioxidant properties. Again, they're our friends, the cruciferous vegetables. We won't go through them again. Avocados, amazingly healthy, especially when people are trying to decrease their BMI. You need lots of the good fats, and you need to cut out the bad fats, which we'll look at in a minute. Nuts are also amazingly good, almonds and walnuts specifically for reproduction. Also, one Brazil nut a day gives you all the selenium you need to make good sperm. So nuts across the board are a really good source of nutrition and protein and amino acids. Green tea is also an amazing antioxidant. Spices like turmeric, cumin, kelp, mushrooms, all of these are anti-inflammatory foods. Now, if you're going to be really good on this way of eating, you can reward yourself 2 or 3 times a week with a square of dark chocolate. It should be 70% or more of cacao, which means that it has almost 0 dairy in it. So that would be your reward. And then again, remember, olive oil, avocado oil for eating, coconut oil for cooking. And let's not forget sweet potatoes, regular sweet potatoes, or those lovely purple ones that originated in Okinawa. Those are amazing for men's reproductive health.
What is it about the sweet potatoes that helps men?
It's the antioxidant properties that are so good. They do give us quite a rise in sugar, but it's short-lived and it comes right down. But it's mainly for the antioxidant properties.
So our next slide is foods to avoid. So give us a little overview
Sure.
of why these are bad.
Now, if most of what you eat is on this list, you have really some serious work to do here, because we've already mentioned sugar, gluten, and dairy. And, this is not to minimize this, because, sugar is more addictive than cocaine. So it's easy to say, cut out the sugar, and it's the most difficult thing to do, but it's really very, very important. Pass on regular cooking oils, cook with coconut oil, eat avocado and olive oil. We said red meat no more than once a week. Really avoid anything that's processed, because when they go to processed meats, like lunch meats and things like that, they add a tremendous amount of, foreign chemicals, additives, a lot of salt, a lot of solute load. So avoid processed foods, refined grains. Now, if you're snacking and you're having snack foods, if you're having sodas and sweet drinks, if you're having fried foods, this is just firing up your immune system and your level of inflammation in the wrong direction. We mentioned alcohol. I would say even social drinking, if you're going to provide eggs or carry, you need to just drop it completely, because it does fire up inflammation. On the sperm side, if the sperm parameters are good, you can have up to 5 alcoholic beverages in a week. But if the sperm parameters are poor, you need to go also then with no alcohol. And then, if you look at what's in what you're about to buy in the supermarket, and it reads like War and Peace, and you can't pronounce most of the names, you've got to just drop that product and go for something, closer to the farm.
Well, getting back to sort of the next part of it is stress. I know, again, I talk about myself, but I spent a lot of time trying not to be stressed, which stressed me out during my not working, trying to work. What do you counsel your patients on dealing with stress and the mind-body connection with infertility?
Sure. Almost everyone on this webinar today is a high achiever. And, we've all been raised with the kind of notion that if you work hard enough at something, you'll get it right in the end. But, there's some things like chronic diseases, and infertility falls into that situation, something that just defies, resolution as hard as you try. And, this does cause stress. We all have stress related to work, to family, and, goodness knows the country's in turmoil right now, and the whole world is in turmoil. But, it's not as easy as saying, I'm going to quit my job, I'm going to emigrate, because, most of us need a certain amount of stress to remain vital. But what you need to try and do is to cut the connection between elevated levels of stress and firing up your physiology in a negative way. So you really need to try and acknowledge that we all have stress in our lives, and you can't just wish it away, because that would be even more stressful. But you need to manage how that sets off your physiology. And the way you can do it is by looking at things like mind-body seminars. You can sign up for one. There are lots of them available on YouTube. There are TED Talks on this. For some people, it might be yoga, meditation, visualization, or prayer. We know acupuncture can mitigate stress and can also do all sorts of other things, like improving blood flow to the pelvis and the ovaries. And again, as we mentioned earlier, it's this loss of control that that you want to try and reestablish through having a very clear plan and a path of how to resolve your fertility issue. Now, there's a very good study that came out of Italy where they administered a questionnaire to patients doing conventional IVF, mainly to the egg provider and the carrier, the female partner. And what they found is that the higher they scored on the stress questionnaire, the lower was their implantation rate, even for a normal embryo. And the link here is, this elevated stress fires up your physiology, fires up immunology, and you have excessive inflammatory response, which then decreases the likelihood of implantation.
This is one of the questions that we wanted to touch on is this approach the same for men and women? I know we can all eat healthy, but do you see a difference between the male contributor and the female?
Sure, to the extent that, as you said, we should all be healthy because we want to enjoy life and we want to live a long time to look after these kids, there are differences because, the egg provider and the carrier compared to the sperm provider, the egg provider and the carrier almost do 95% of the heavy lifting here. So there are going to be some differences. So the optimum health is very similar, but I can say that the gluten and dairy restriction, there's really no science to show that it makes a big difference to the sperm one way or the other. And that may be because we are able to select one good sperm when we do the IVF with ICSI. And even if a man has a low sperm count, we're still dealing with many millions of sperm. So, it may be that the gluten and dairy restriction is not that important when it comes to the sperm provider. But, given that the sperm providers are going to be good support people in their household, they should probably consider doing that just to assist the egg provider. Can you go back a slide there?
Oh, yeah,
Michelle?
sure.
So, I think the diet is similar, although, as I said, I can't say that gluten and dairy restriction is a must for the sperm provider. The supplements are a little different in that we have a few extra supplements on the egg provider and the carrier side. And lifestyle, we'll talk a little bit about lifestyle in a minute, but smoking, we're not even going to spend more than 10 seconds on that. If anybody smokes and they're trying to have a baby in any, capacity here, it's just anathema. So we won't waste time on that. The BMI is really important on both sides. And I know there's a question coming up on that, whether it makes a difference to the sperm. So almost the same with some differences for the egg provider and carrier who really does the lion's share of the work.
So should we talk about sperm?
Sure.
And how this this approach can help sperm donors and intended fathers? Let's
talk about sperm. So, as I mentioned, with ICSI available and with methods of selecting the best sperm, a method called Zymote, it's very forgiving even of very low sperm counts, but the sperm quality, even at the level of the DNA, will be better when a sperm provider embraces the optimum health from the eating point of view. The supplements, really important, and they range from, a multi to CoQ10, omega-3, vitamin D, and then also a good antioxidant. So the diet and the supplements, really important on the sperm side. And then, of course, lifestyle. You have to be healthy, not only for longevity, but to produce good sperm.
Okay, so what about eggs? How does doing this actually affect the reproductive issues of the egg quality?
Sure. So here we have the heavy lifters, okay? These are the people who do most of the work here. So we know that gluten and dairy restriction, sugar restriction, no alcohol, all make a huge difference. The cycle of recruiting eggs is anywhere from 6 to 12 weeks. So, we do want to be on the optimum health at least 4 to 6 weeks if you've already been partially good before. If your diet consisted of everything on our bad foods list there, then if the eggs are not too old, you may want to try and get even 2 to 3 months. But no question, the diet is hugely important. We add a couple of extra supplements on the female side. We add methylfolate, which is the salt of folic acid. Always better to get the salt of folic acid and not folic acid itself. And then there's also a supplement called PQQ, which is a first cousin of the CoQ10. What it does is it increases production of mitochondria in cells, and the mitochondria are the little power packs that supply energy for cellular function. Now, inflammation is bad for eggs, and it can decrease the quantity and quality of eggs. I don't believe that inflammation can actually increase the percentage of embryos that are abnormal. That is usually driven by the age of the egg. But overall, inflammation is not good for eggs, so that's why we have to work on it, every which way.
And what about the next slide is about the embryo transfer. Tell us a little bit about how this can help with embryo transfer. I expect it's something to do with uterine lining and blood flow, but I'll let you explain that.
Sure. So, we obviously need to start with the optimum health here because we're talking about somebody who's going to be a carrier. Now, that person may have provided the eggs and gone through stimulation and already been on the optimum health, or this might be somebody who's specifically a gestational carrier, or it might be somebody using a donor egg who's now going to carry the embryo herself. Now, when we talk about optimum health and embryo transfer, we're kind of straddling here the optimum health side and the maximum science. So we're kind of encroaching on our next webinar a little here, but no question on the carrier side, you want to be following gluten, dairy restriction, no sugar if you can, no alcohol, all the supplements, so that your inflammation is really at its lower or optimal level in the background. And then we start encroaching here on maximum science. We're talking about making sure that the cavity of the uterus is healthy, no polyps or no fibroids or no scars in the cavity. And then you want to also confirm that the window of receptivity is where we expect it to be. And this would be a test called ERA, part of a mock cycle. And you also want to exclude, especially in people with recurrent failed implantation in the past, you want to exclude an inflammatory effect on the endometrium, which is usually secondary to endometriosis, which you may know you have or you may not know. And that's again through the other part of the mock cycle, and that's called the receptiva side of the test. And you also want to be supplying optimum support in the form of estrogen and progesterone, for that developing embryo, which you've then transferred at the optimum time. And then because 70% of losses are due to the embryo not being normal, you do want to focus on testing embryos to know which ones are normal, and then focusing on putting in one normal embryo at a time.
Do you have studies that show the differences? Like, have you compared differences between people who take this kind of optimum health, decreasing inflammation approach and those who don't in terms of implantation rates?
So, I'm so convinced over 35 years of doing IVF that it's beneficial that I think it would be unethical to run a study where you told one group to eat the bad foods and you didn't do any of these things, to compare. But you can certainly see that patients who are behaving as their own controls, when they get real tight on the optimum health where they were maybe just flirting with it before, you can actually see an improvement in their own production of eggs and embryos and implantation.
I think we're going to go to some questions, which we kind of came up with some of these questions based on people's feedback before the webinar, but can you improve egg quality?
Sure. I think, you know, if you've been listening to this webinar so far, you'd have to believe that all the things we spoke about are geared to decreasing inflammation, and decreasing inflammation will allow you to improve not only the quality of your egg, but also the quantity of eggs that we can recruit given your, you know, your egg reserve. But as I touched on earlier, the thing we cannot really change is the percentage of those blastocysts that will actually be normal, because that is driven almost exclusively by the age of the egg. But for sure, if you can increase the number of eggs by 20 or 30%, you're going to have more embryos to test, and you have more rolls of the dice at then getting a normal embryo or 2 or 3 to work with.
I think we kind of touched on the second question about the differences in dietary requirements, unless there's anything else you want to say
on the egg and the
that.
sperm. Yeah.
Yeah.
No, I think we said it all.
Just eat those Brazil nuts.
There you go. 1 Brazil nut a day.
Exactly. And then any real life examples that you can give us?
Sure. I see them every single week. You know, on the one end, we have patients who have issues with polycystic ovarian syndrome, or just polycystic ovaries without the syndrome. We have patients who start working on the Optimum Health. They start working on their BMI, and the BMI comes down safely but steadily on a high protein, low carbohydrate diet. And all of a sudden they start ovulating more regularly, and the patient is pregnant before you can get to do the IVF. So, you know, that's bad for our statistics, but it's great. And I see that all the time. And then, as I mentioned earlier, you know, sometimes when I first speak to a patient embarking on IVF and they hear about gluten and dairy restriction, I can almost see them saying, yeah, what does he know? You know, I'm going to do my best, but I'm still going to have my gluten pasta, and I'll have an odd margarita on the weekend. And, you know, goodness, I can't get off my camembert or my blue cheese. And so we do a cycle, and it doesn't go really well. And maybe we don't get as many eggs as we think age and reserve, you know, would produce. And then we do a regroup. And I say, you know, how tight have you been on, you know, all these recommendations? And then, you know, what I hear is, well, you know, yeah, I tried, but I wasn't that good. And we had a girls' night out last week, and, you know, this, that, and the next thing. And so, you know, we then make an agreement to be really tight on the Optimum Health. And 6 or 8 weeks later, we do another cycle. And it's almost like that patient brought a different set of ovaries, because we get more eggs. The embryos may be physically better quality, but unfortunately, we still will have the same proportion that will be normal based on the age of the egg. So I see this every week in my practice.
Actually, that kind of leads to a question we've had from Larissa that says, after implementing these changes, how long does it take for egg or sperm quality to show improvement, specifically giving up smoking? Do we know how long it takes?
Sure. So, you know, given that the egg cycle at its maximum is about 3 months, for sure, 4 to 6 months is what you need on the Optimum Health if you've been somewhat good in the past. But smoking, you know, really, it takes up to 5 years to get past the negative effects of smoking, especially if you've smoked on a regular basis. But certainly within 2 or 3 months of stopping, you know, the effect on inflammation and the effect on the eggs and the sperm is going to be very noticeable, because sperm is also on about you know, an 8 to 12 week cycle. So, for instance, if you wiped out all your sperm by having a sustained fever for 3 or 4 days, it'll take you 3 months to get back to where you were before.
Right.
So, you know, smoking as far as the egg and the sperm goes, probably 2 to 3 months if you have the luxury. Now, if you're 43 doing IVF with your own eggs, you have to weigh up whether waiting 3 months is going to hurt you more from the biological clock point of view than you're going to recoup, from the Optimum Health.
Right, exactly. What about the BMI in men? And does it impact sperm quality? We did touch on that a little bit, but.
Sure, absolutely. So, what happens is as the BMI goes up, and, the optimum BMI for all of us is somewhere between 19 and 28. And we're already stretching it a little at 28 because, in North America, we have way too many of those bad foods on my bad food list. But 28 is kind of a compromise here. But in a man who has an excessive BMI, what actually happens, guys, is that in the peripheral fat, your testosterone is being converted to estrogen, which is the female hormone, and that's going to impact your sperm recruitment and sperm maturation negatively. So there's no question that from a hormonal point of view, an elevated BMI is working against you. Also with an elevated BMI, your testicles might be, they might run a lot hotter, and that's also not good for, for optimum sperm production. So no question, elevated BMI is going to work against a good reproduction. But fortunately, the ICSI in IVF, allows the sperm not to be a rate limiting step to the same degree as the egg.
Actually, thinking about BMI, because obviously we work with a lot of gestational carriers, and I see a lot of posts on Facebook that says, well, my BMI is elevated, but I've had 4 kids. I'm really healthy. My BMI is 34. Why can't I be a surrogate? What's your opinion on BMI in the carrier, specifically for gestational carriers, surrogates?
Sure. Yeah, I would say that that's a biased sample reporting, I think there are probably millions of women with elevated BMI who are trying, who are not getting pregnant, and they don't post to say, gee, my BMI is 34 and I'm struggling to get pregnant. So, it's like you get complaints about vehicles and things on the internet. It's the squeaky wheel that gets the oil. And, this is a biased reporting sample. That's my first point. Secondly, we know that if you look at, say, a single program, there was a really good study out of Chicago looking at about 2,000 conventional IVF cycles. And when they just looked at the BMI of the person receiving the embryo, it's almost a straight line down from 60% pregnancy rate when the BMI is under 25 to 15% when the BMI is over 35. So for sure, with assisted reproduction, there's a difference. And of course, if you're being a gestational carrier for somebody else, that's assisted reproduction. It's not getting pregnant naturally, where maybe somebody can try 12 times in a year. And so, yes, it worked once in a year and you've had 4 kids over 4 years, but what about the other 11 months? So, we can't afford somebody working through the Donor Concierge getting a surrogate. We can't afford to be one of those 11 months in the year. So we have a cutoff at 28 on the BMI for a gestational carrier. And I know you guys at the Donor Concierge know this over many years. And if somebody's a little over that and they have really good credentials for the rest for being a surrogate, there's no reason not to screen. But that surrogate needs to make a commitment to eat healthy, to be on a low carb, high protein diet without starving. I mean, nobody can gain weight successfully and safely by starving. You have to have totally adequate calories. You have to have all the good fats, but as low a carb, maybe even to the point of keto, but for sure to the point of paleo. So we have a line in the sand at 28 on the BMI for a gestational carrier. And, goodness knows, most of the folks on this webinar, if you're looking to do surrogacy, it's a very expensive process, both physically, emotionally, and financially. So you really do have to, dot the I's and cross the T's right up front.
And not to mention the the risks to the surrogate herself, the woman herself is going to be carrying, if her BMI is elevated, it can increase complications in the pregnancy, correct?
Correct. So somebody who's pregnant with an elevated BMI, the risk of congenital abnormalities is higher. And these are abnormalities not driven by genetics. These are the same abnormalities that we see in women who are diabetic. These are problems with the neural tube not closing. These are problems with the heart. Those are increased in women with a higher BMI. There's a higher incidence of pregnancy-induced hypertension or toxemia, higher incidence of gestational diabetes, deep vein thrombosis. So, you know, all of the complications of pregnancy are elevated when the BMI is elevated, whether somebody's having their own baby for themselves or being a gestational carrier.
And I just want to tell people who are watching, if you have questions, please put them in the Q&A box and we will have Dr. Zouves answer those questions. We have one last question here, which is about acupuncture. And I know you're a big fan of acupuncture. Tell us about acupuncture and when it's recommended.
Sure. Yeah, I'm a big fan of acupuncture because, as you know, Eastern medicine, you know, embodies all of these principles of optimum health. You know, at the end of the day, we are what we eat. I like it that acupuncture does look at diet and also recommends no gluten, dairy in the diet. Acupuncture, even although we can't explain how it works, it's been around for 6,000 years. And you know what happens by trial and error, you know, the practitioners that are not good, you know, they kind of just disappear. So acupuncture has stood the test of time. We know that it can increase blood flow to the pelvis and the uterus. We know that it can decrease stress. It can also, you know, help with pain. So there's really a lot of benefit to the acupuncture. From the transfer or implantation point of view, there's clearly an advantage for acupuncture around the transfer. Before and after the transfer, there's clear evidence. There are a couple of protocols. The Swedish protocol is one, you know, that one can do. But also for somebody going to provide eggs and going to then be a carrier, acupuncture over time can not only help with stress, but decrease inflammation and also increase good blood flow to the pelvis. And there you might need to do it for, you know, longer, maybe even 6, 8, 10, 12 weeks to get the maximum benefit if you have enough runway on your ovarian clock.
And what about for men? How does acupuncture help men in reproduction?
Sure. I think that acupuncture can help men on all those other things we mentioned, you know, stress reduction, pain relief, general good health. But because the ability to home in on one sperm, even from a low sperm count, I don't see that acupuncture long-term for a man is going to make a significant difference that you'll get better fertilization or more embryos at the end of the day. But
I'm just going to make a comment, going back to the mind-body, if anyone hasn't been to acupuncture, it's actually very relaxing too. So it's self-care and providing a place of safety and stress-free where you can just lie there and have the acupuncture needles. So that to me is the added benefit as well.
Sure, it's forced relaxation, you know, and as I mentioned earlier, you know, most of us are AAA personalities. Most of us are probably quite OCD, and those of us who are really honest will admit that we're probably very OCD. And so, you know, you do have to give yourself permission to wind down and relax and actually address cutting the link between the stress that we all have that's very necessary and firing up your physiology. And acupuncture is one of the ways of doing that.
So we don't have any more questions, Dr. Zouves. If there's something that you can summarize what we've talked about, is there, you know, what would you say to somebody who's overwhelmed by all the things that they have to do, going through this treatment? We have this list of things they can do. What would you say to somebody who's going through this?
Well, I think whenever you're faced with, something that's kind of resisting resolution here, you have to break it up into pieces, and you have to attack them kind of in sequence, but not only one at a time, because you may not have the time to take 3 to 6 months off to do some of these Optimum Health treatments. But I do think that you want to have a plan. You want to try and get back the control by knowing that you have a good team involved with looking after you, that they are actually offering you the modalities of treatment for you to choose from. And you definitely want to start, given that this is a triathlon, you want to start on training. So you do want to start with the Optimum Health. And then, you need to rely then on the practice you're working with to supply the maximum science. And, I think you're going to be showing us in a few minutes, Michelle, a QR code and some links. But there is a
Correct.
QR code which will take you to like a 40-minute webinar, which basically talks about both the Optimum Health and the maximum science. So, you can get a leg up on our next webinar by scanning that QR code or following one of these links.
Yes, and I also put the link for your fertility center. Lots of great resources there. Dr. Zouves does regular webinars as well. I believe it's in the evenings. Is it Tuesday or Wednesday evenings?
Every 2 weeks on a Wednesday. We have another one tonight. So today is webinar day. Great,
and it's free for anyone to join. You don't have to be a patient, correct?
Absolutely, yeah.
Great. Well, thank you. There's one more slide, just a little summary. That's me, that's you. Thank you very much for joining us. We will do another one about maximum science. So we look forward to it.
Michelle, thank you so much for asking me to do this. And I hope everybody has enjoyed this as much as I've enjoyed chatting with you. So take care, stay safe, get your COVID vaccines, guys. COVID is fighting back.
Absolutely. No, thank you. I don't want to get COVID. All right. Have a wonderful day, Dr. Zouves. Thank you.
Thank you. Bye.
Bye.